Hello everybody, welcome back to Modern Dentures. I'm back in my office again. Been a bit of a hectic few months what with setting up the new clinic. I've still got a few more videos that I want to do about that, as I mentioned before, about like the finances and how much it costs to set up a denture clinic, the difficulties, you know, the sort of hurdles that we've had to overcome. It's definitely not easy, and it's not for the light-hearted setting up a clinic, but it's definitely doable. If anybody is thinking about setting up their own clinic and you want a bit of advice, I'm more than happy to have a conversation with you about it. Or if there's any of you out there that are looking for a partner in setting up a new denture clinic or even a dental practice, then again, I'm happy to have a chat with that. Just a caveat that anything that I do in terms of joint ventures with anybody, it always includes me and my brother and Matt, who are both my business partners. Because we always work as a team, what we usually do in any sort of joint venture is we do it as a 25% split between us. Obviously that's negotiable depending on what's going to be involved with investment and things like that. But yeah, happy to talk to anyone really, or if you just need some advice and that, you know, you want to do it on your own and there's certain things that you're not sure about, I'm more than happy to talk about. I've done it several times over the years. In the past 25 years I've set up various laboratories and dental practices and denture clinics. As the years go on, it's obviously getting a lot easier to do. When you do something a lot, it you know, does get easier. But that's not what this video is about. This video, I just wanted to talk about small dentures. This is something that I see talked about quite frequently, especially on the technician forums, and it's little side plate dentures that maybe have got 2 or 3 teeth on them and they just clip in on one side. And I think the contention there is that these dentures can be dangerous because they're so small. If they was to dislodge, they could be swallowed or they could get stuck in your throat or something like that. While I agree with it to a certain extent, I also disagree with it in certain situations. So if it's a single tooth and it is really small, then I believe it couldn't be a choking hazard. If you think about the size of the food that we tend to choke on, it's usually peanut size. It's not actually that big. Anything that's a bit bigger than that, it would be too difficult to get stuck in your throat generally. And you know, if it's too big, you can just take it out of your mouth. Choking because it's aspirated, so it's been breathed in. Breathing in a little peanut, which doesn't weigh much, as you're eating and talking at the same time or something like that, is when that would happen. If a denture becomes loose and you breathe it, it's unlikely that you're going to be able to breathe a denture in, especially if it's made of metal, because it's got a little bit of weight to it. I'm not saying it's impossible and never happens, I'm sure it does, but I'm just talking about likelihoods. So that's one aspect to it. And I think if something's got, I'd say 2 teeth, but I'm talking about back teeth and molars, which are generally bigger. So a couple of teeth, or 3 or 4 teeth, I think they can work. But one of the really important things about these types of dentures is their retention. If a denture is designed really well, it's a metal framework and the clasps have got long arm stress breaking clasps that sometimes you can make them double back onto a tooth or something like that, then they can click in and they stay in place, and that will drastically reduce any chance of a patient choking on something that's really difficult to take out because it's clipping into place. If I do make one, which is rarely, but I do them on occasion, and this is why I'm bringing this up, because I have made one recently where a woman, one of my patients, she's got a lot of, all her own teeth actually, she's just got 3 teeth missing, two bicuspids and a molar, so the 4, 5 and 6, and had a plate that covered the roof of her mouth, which she found very uncomfortable, obviously closing all the taste buds and everything else. So for me, what I would normally do in this sort of situation would be make a metal framework that would then go all the way round, clip around back teeth and around the teeth where they're missing. However, for her, there was nowhere to clip the denture in on the opposite side of the mouth because got all her teeth, including going back to the eights, very close occlusion. There was no space for going occlusally to put clasps in on the other side, which I very rarely do that as well. If I do that, it's usually in the sort of situation where a dentist might have adjusted the teeth to make a pathway for the clasp to go through. The reason for that is occlusally trying to get the metal framework to go over an occlusal surface of the tooth nearly always causes problems for me. I don't know why, I've never really figured it out, but I end up having to do multiple adjustments in those sort of situations, otherwise the denture will rock or it just won't seat properly. So I try and avoid that where I can, unless there's been a channel cut between the teeth so that we can get through that occlusal space and then clasp on that side. For her, she's a fairly young woman, very good, strong, healthy teeth. I didn't really feel like we should be cutting into her teeth unless it was really necessary. So I was quite confident I could get good retention on that side. So I made a little chrome denture and it clicked in. It's nice and tight. This is at the trying stage, so I haven't finished it yet. We're finishing it and fitting it next week. It's successful. The other thing that I advise the patients in this sort of situation is that you use a little bit of glue on it as well, just because with that glue, even though the denture might be clipping in really well and be quite secure, if you've got a little bit of glue there as well, if you are eating and it comes loose, the glue will stop it from falling out completely. Because if you imagine the clip which is retained onto that tooth and then it just dislodges a little bit, the whole thing could then fall down, get caught up in the food, and I think that they would choke on it in that situation. It could be very uncomfortable for them, possibly even swallow it. You know, if that small denture is in a bolus of food and it's a large guy who eats a lot, and I could imagine that they could actually swallow a denture of that size. Some people, most people, if their denture dislodges while they're eating, it's more likely that it would maybe damage their mouth because they sort of bite into it and it, you know, clasp might stick in or something like that. I think that's the most likely thing that would happen in that situation. But just with a little bit of glue, even if it did sort of come unclicked, it wouldn't come off completely because the glue would help sort of hold it in place. And I always think that denture fixative is a really good thing for people to use as well. If they're just using a really small amount, it just helps stop the food and little seeds and things like that getting under their dentures, even if their dentures are really well fit in, especially on the smaller plates. Definitely helps. If somebody's got like a full upper denture, they've got a great seal on it, it's unlikely that they need to use it in that sort of situation. But that's my thoughts on little sectional side plates. I would love to know what you guys think. Obviously comment on this video. I always look at my comments. Most people tend to message me, which again is fine, or email me, or comment on my posts on Facebook. Although these days I'm not going on Facebook too much. I go on there occasionally, but I find I get too distracted, and you know what these social media is like, end up going down these little rabbit holes. So I'm sort of like trying to limit myself from the doom scrolling and just go on there to do my posts and not get caught up in it. Although I do spend way too many hours watching YouTube videos like this, but I think that's more productive use of my time. I'd love to know what you guys think about that as well. But yeah, that's my thoughts on the small sectional plates. I'm all for them. I think they're really good and I think they work really well, but with the caveats of those things that I mentioned, that it needs to fit properly. It needs to be retentive. It needs to be able to just clip in so that it's safe. It also needs to be of a certain size. And as I say, usually 3 teeth or a premolar and molar, but good retention on both clasps, either side of the teeth that you're restoring. I hope you found this video useful. Back to my normal sort of in my office. It's nice to be shooting these videos. I think I've got a patient booked in soon where I'm doing another clinical video, which I know a lot of you found useful and interesting. If you did want to take a look, just go through and have a look at some of those clinical ones. They're quite useful for seeing how I do things. Obviously we all approach these things differently, and you know, in this industry it's sort of quite an isolated job in a way, in that we're not working as a team. We have to figure a lot of stuff out for ourselves, and so just being able to see how other people work, I think you can learn a lot. At least that's what I'm getting. The feedback is what I'm getting from people. Again, it's usually direct messages saying that they love my video. I was like, yeah, it's great, but go and like it on YouTube. Don't tell me. Like it on YouTube, because if you do, if you just click that little thumbs up, it just means that Google is going to share it to more people will get to see it. And that's the whole point of me doing these videos, is to help share my knowledge, and even if it just helps one person just change the way that they're working to get better results, then I feel like I've done my job. And subscribe. If you subscribe, it really does make a difference. Subscriptions, the views that you get is even more than likes if you subscribe. Obviously you won't miss these videos. Also, the YouTube algorithms will push it, and you know, that's been tested by all sorts of people, and it's the best way to grow a channel is just getting your followers to just hit that subscribe button. So if you do, I really appreciate it. It helps grow the channel. It means that I'll keep doing these videos, and I'll definitely get more in the clinic, those clinic videos. I can't do those easily. You know, you've got to get the consent from the patient before you start filming them. A lot of people, especially with dentures, don't want to be filmed, but I will be pursuing that a little bit more over the next few months. Hopefully we'll see you then. Like and subscribe, and we'll see you in the next one. Thanks guys.